Hi, welcome. Today we have a very special guest back to spend some time with us, Shawn Holtel. Shawn is a certified yoga therapist, and she teaches a practice as part of her therapy with clients called interoception. And interoception is kind of our awareness of our body's signals. And this is part of our mindfulness series or stress management series or emotional regulation series. Just offering more tools to help us kind of manage the significant amount of life stressors that are present in our world right now. So welcome, Shawn. I'm super excited to learn what you have to teach us today. So welcome, Shawn. Thanks for joining us today.
Sure, it's good to be here.
So do you mind first maybe starting to tell us what is interoception?
Sure. Interoception is how we perceive our internal sensations. It's sometimes considered the eighth sense. We have our five senses, which we all know. And then we also have proprioception, which is how we relate to things in our outside world. And interoception is how we relate to our internal awareness or our internal world, what's happening inside of us. It involves things like our ability to know when we're hungry, when we're full, when we have to go to the bathroom, if we're having some kind of pain signals. So it can be somewhat subtle. And as you know, as our children growing up, we learn to either cultivate these signals, these messages from our internal body. And sometimes we kind of learn to turn them off because they are subtle and we can override them a lot. Mm-hmm. So building interoception is really important for our emotional regulation.
Yeah, that's great. I can relate to that. I mean, there are times in, as a resident or medical school where you don't really get to eat or you don't get to use the bathrooms, or you learn to turn off those signals. And I'm sure that people have the same experiences in their life. So yeah, and I think hunger signals are one that can be real hard for people to tune back into once they've learned to kind of block those out, either eating through those or ignoring those. So how does interoception help us kind of with stress or with emotional regulation?
Okay, so I'll explain that emotional aspect of it and how it kind of follows in a line. So depending on how our interoception is, how well we're tuned into our bodily systems, all those little bodily signals that we're taking in sends messages to our nervous system. So if we are accurately perceiving those signals, then we have good feedback and we know, and we have good emotional regulation. If we do not, all those little signals that are coming in it's making our body feel a certain way. So it can make our shoulders tight. It can make our breath constrict. It makes certain things happen in the body. Mm-hmm. So when those happen, our body is perceiving whether it's safe or if it's in danger. And all this is happening kind of in the background. Unless we bring it to the forefront and we really bring our attention to it, which is what happens when we do these interoceptive practices, it's just happening. We don't have cognitive input on it unless we choose to. Mm-hmm. So depending on what's happened in our life and what kind of life we've had, that system we can either kind of turn it off and ignore it and not pay attention to it. And sometimes we do that for a very good reason for different times in our life. We may have to turn some of those signals off to be able to survive. So we do things in our own best interest, even if we don't realize that's what we're doing. So they can be toned down because of trauma that's happened to us in our lives, or stress, like you were mentioning with your schooling, and a lot of people with jobs, it can happen. Or it can happen the other way, where we're getting too many internal signals, and it can cause a lot of anxiety, and it can feel like too much is happening. So all of those, like I said, it makes us feel a certain way in our body. So then once we feel a certain way in our body, our emotions then are connected to that. If we're feeling really dull, we're not going to be in tune with what's happening with maybe a family member who, you know, that needs some attention and needs some emotional support. We're not even going to maybe notice that they need that. So it definitely, by what's going on inside of us, it comes out as to how we reflect in the rest of the world. Does that make sense?
Yeah. So do you mind if we talk about the trauma that you mentioned for just a minute? So some people obviously grew up with very traumatic childhoods, and I imagine, you know, their learned response is to kind of like dampen or tone down their fear, right? So they kind of, something might be very frightening, say there's domestic violence in the home or something like that, and they are trying to kind of like underreact. Is that,
Absolutely.
and so it may be harder for someone that has an experience like that to then notice those signals in their body as they get older, or vice versa, right? It could manifest as an overreaction later in life. Is that what you see happening? I know you've worked a lot with trauma, even with veterans of wars, and worked with some of these practices. What do you see happening in their bodies?
Yeah, that's exactly what happens. So the experiences that we've had before, and our body adapting to those experiences sometimes then become maladaptive as we are moved throughout our life and into different experiences. So that's exactly right. And there have been studies that have shown that interoceptive practices help to regulate that system, whether you're you're dampened down, or you're feeling too much. So it opens that window of tolerance to be able to feel that system as it's really happening in the present moment, and not letting the past come in to hijack those feelings.
Mm-hmm.
Right?
And I think this practice, probably a lot of people, it's less scary because, you know, we sometimes think of therapies as mind-based therapies like cognitive behavioral therapy, or body-based therapies like somatics, or like this practice. And I think sometimes the body-based therapies feel safer to people because they don't, it's very scary to think about like bringing up something that happened in the past or reliving it. And I don't think that needs to be the case. You can go kind of from where you are right now and work with what's going on in your body without having to relive all of those events.
Absolutely. I'm so glad you brought that up, because when we did work with the veterans, there were so many of them that really did not like the exposure therapy. And from a yogic standpoint, those exposure therapies in a lot of ways are just re-traumatizing. It's making them live that experience over and over again. Mm-hmm. So those types of therapies are a top-down therapy where you're working with the brain to get to the body. Mm-hmm. And the body-based therapies are bottom-up therapies. Mm-hmm. So we're working with the body to let the mind know that it's safe. So we work in that way. And actually moving the body is very calming in specific ways, is very calming to the nervous system. So it is less invasive, I guess you could say, mm-hmm. For a lot of people. Yeah.
Yeah. Well, good. Do you want to tell us any more about interoception, or would you like to do a practice, or how would you like to proceed?
Yeah. Well, definitely, let's do a practice, but just to kind of wind up that connection with the emotional piece, because I don't know if I completely went through that. So knowing how, understanding how you are reacting as your body's feeling, that is where the emotional piece comes up. So however our body is feeling, we're taking cues from that, whether we realize we are or not. So people can probably think of certain situations that they've been in where they've responded to things very reactively or emotionally, where maybe if they've taken some time to think about how they reacted to that, they might think, wow, I can't believe I responded in that way. If that would have happened, 6 months ago, maybe I wouldn't have been so reactive, or vice versa. So the more in tune you are with what is actually happening in the present moment with a situation, you're able to respond differently. You're able to have that emotional regulation and realize what's happening in your body. And not to say we're not going to have things that aren't going to tick us off or set us off or, whatever. But what happens is when we're doing the practices to widen that window of tolerance, we're able to handle more. We're able to notice when our muscles start clenching, when our breath starts being shallow, or we're holding our breath. We notice those bodily actions a lot sooner, and we respond then accordingly.
Yeah, I even noticed that even, throughout the day, I try to tune in to, how is my breath? How is my body? And even little times, like maybe I'm just driving somewhere and I notice that my breath starts to become a little shallower, or like I'm almost like anticipating something bad might happen or something. So and then in that time, if I slow my breath down and kind of relax, I realize that the signal to my body is changing and I feel much calmer.
Yes, absolutely.
Yeah. And I think we talk about, go ahead.
As you know, the breath is one of those that we talk about a lot, because the breath is that direct link into the nervous system. It's something within your body that you can pay attention to. So it's one of the biggest tools that we use within our interoception toolbox, I would say.
Yeah.
But there are lots of other things that we can do. There are, not everything's going to be comfortable for everybody. So that's another reason why I love these tools so much. If somebody has a lot of anxious energy, there are movement practices that we can do to calm down the nervous system. It can be very individual, and wherever somebody is, if you think about downshifting a car, where you are in your body, that is your car, and like I said, what's sitting down in meditation is a wonderful interoceptive practice, but that is not going to work for everybody, especially somebody who has a lot of nervous energy in their body. It's not going to be successful for them. So there are movement practices that can be comfortable for them, but they're still down-regulating, downshifting their nervous system.
Yeah, sometimes it is hard to sit down in meditation. So something that can kind of just slow us down and allow our body to relax and send those signals. I mean, we talk about this in heart math too, right? That our heart sends more signals to our brain than our brain sends to our heart. So when we're breathing a little slower and our heartbeat is a little slower and more regular, then we're sending that message like, I'm okay, I'm safe, I can rest, I can digest my food. And so learning to go to that place and recognizing those signals that are telling us we're not in that state, we're in that like overactive sympathetic state that's kind of revving up our system. And then how do we recognize that and switch to that more parasympathetic response?
Yeah, sometimes it has to be very intentional, because that sympathetic system will take over because it's designed to protect us. I don't ever want it to sound like it's the bad guy, but it is dysregulated in a lot of people in our society, especially right now. So in order for us to reel it back in, we have to do that very intentionally.
Mhm. Yeah, that I like how you said that. That sympathetic response is definitely there to protect us. I mean, it's, if we are about to cross the street and the car is coming, immediately our heart rate goes up, our blood pressure goes up, we sweat, we stop digesting our food, we breathe a little faster. Like, it's there to protect us and save our lives. But sometimes we rest there, we stay there when the threat is gone. We're still in that state that is not serving us any longer.
Right. And another point to bring up with that is if somebody has been in that state most of their life and they're kind of
Pretend you didn't hear.
then down regulating can not feel normal to them and be uncomfortable. So just understanding that and knowing that, I think, is important. So sometimes just starting these practices may not feel great in your body at first because it's foreign.
Mm-hmm.
The body's not used to being in a parasympathetic state or rest, renew, heal part of our nervous system. So it does take intentional practice, but it's definitely worth it.
Mm-hmm. Yeah.
Yeah.
Good. So do you want to lead us through a practice?
Yeah, let's do a little bit of a practice. We'll do a little bit of a breath practice and a little bit of just a muscular tension practice. And this is kind of part of the somatics. And most people are probably sitting down or sitting at a desk or something now. So if it's comfortable for you, maybe soften the gaze of your eyes or close your eyes. And just tune into your breath. Without trying to change it or anything, just tune into where it is. If it's coming into your chest or into your low belly, and just be aware of that. And notice if you can feel the inhales and the exhales coming in through your nostrils and leaving through your nostrils. See if you can feel that light touch coming in and out of the nose. And without trying to make the breath really big, just bring it down into the belly a little bit. So then maybe your belly button extends out on the inhales and then softens back in on the inhales. And maybe let the exhale leave the body a little bit slower. The inhales coming in. And now if your hands are resting in your lap, just let them drop down to the sides of your chair. And bring your attention to your right hand. And gently begin bringing that right hand into a fist, just using about 30% of your muscular effort. It doesn't have to be really, really strong. Make a fist in your hand and let that muscular tension move up your forearm, up your upper arm, and let your shoulder even come up toward your ear a little bit, bringing that tension into the shoulder intentionally a little bit, raising that right shoulder up. And then release that contraction in the opposite way. So relax that shoulder back down, soften the upper arm, soften the forearm, and soften the fist. Do that one more time on your own. Start with the right hand fist. Work all the way up to your shoulder, maybe bringing that shoulder up toward the ear a little bit. And then releasing back down. Notice when you release back down if there's any little jigs or jags or jogs in your shoulder. And then move to the other side. The left hand comes into a little bit of a fist, forearm contraction, upper arm, shoulder, come all the way up to your ear, toward your ear. And then relaxing back down. And do that one more time on that side. And then notice if you can soften the shoulders. Once you've finished both sides, see if you can soften the shoulders any more. Maybe with the exhale, see if that muscular tension can let go just a little bit more. Shoulders are one of the places that we hold tension in our body. It's a little different for everybody, but jaws, shoulders, and hips are three of the biggest areas of tension holding. So by coming into contraction a little bit deeper than we may normally be holding that tension, we're able to release that tension. Go ahead and open up your eyes. Let your breath normalize and regulate. And that was a short little interoceptive practice. And understanding why they're important, what we just talked about for the last 10, 15 minutes, makes doing these little practices, you understand why you're doing them. You understand why they're important. They don't seem difficult. They're really not difficult, but they are important in re-educating the body.
Yeah, and it's amazing how just taking that time to kind of slow down and focus on something as simple as making a fist in your hand can really kind of tune you into your body and relax and kind of stop all the thoughts in your head and kind of help you kind of reconnect with your body.
Right, because you are giving your mind something to think about and something to do, which is important for the mind. Otherwise, it's going to go off and do its own little thing. It's going to think of something. So if we turn our awareness inward, and in yoga we call that pratyahara, we turn our senses inward rather than being externally driven, which we are most of our day, right? We turn those senses inside. That's how we build that interoceptive awareness and emotional regulation. And then we are able to open our window of tolerance, reducing our stress, or managing our stress, I should say.
Yeah, I think reducing our response to our stress, right? Yeah, even though there may be a lot of stressors out there, we don't have to react to all of them. So yeah, or we don't have to react as strongly to all of them. So thank you for that practice. That was wonderful.
You're welcome.
Is there anything else you'd like us to know about interoception?
Well, it's one of my favorite topics. I could talk a long time, but I think that's a good starter.
Okay. Well, thank you so much for your time and your expertise, and even for sharing the practice with us today. We really appreciate it.
You're welcome. It was fun.
Thanks.